What is paranoid personality disorder? Understanding the personality disorder. Is your cautious personality harming your relationships? Do you mistrust people who have never given you a reason to do so? Is the quality of your life affected by feelings of paranoia? Are you preoccupied with conspiracy theories? Hi, my name's Sreela Roy-Greene, PhD, LMHC, a licensed therapist with BetterHelp. If you've answered yes to these questions, your cautious nature may indicate that you're living with paranoid personality disorder, also known as PPD. While this is not a diagnosis, as diagnosing a mental health condition generally requires working directly with a licensed professional, you might be curious to learn more about this disorder and how you or a loved one might relate to it. In this video, we'll define paranoid personality disorder, along with its potential causes, symptoms, diagnostic criteria, and treatment options. But first, let's cover the basics of what a personality disorder entails. What is a personality disorder? As humans, each of us can have our own unique personality, made up of different traits and shaped by our experiences. They influence how we understand the world around us and see ourselves in it. They also help us relate to others and adapt to changes in our environment. But when certain personality traits are present, it can be difficult to cope or lead to coping in unhealthy ways. Someone with a personality disorder might have a pattern of seeing, thinking about, or reacting to things in ways that cause distress to themselves or to others. They might have difficulty understanding emotions or act impulsively, making it challenging to relate to others. These patterns can affect various aspects of a person's life, both personally and professionally. Now, let's dive a little deeper into the specifics of PPD. What is paranoid personality disorder? Paranoid personality disorder is one of 3 personality disorders in the American Psychiatric Association's Diagnostic Manual of Mental Disorders, known as the DSM-5, and is classified as Cluster A, or odd or eccentric personality disorders. This is because individuals with PPD may behave in a manner that other people can find unwarranted. Its symptoms usually consist of anxiety, social detachment, misinterpretation of interactions, and continual feelings of suspicion and paranoia, among others. People with paranoid personality disorder might experience severe, impactful trust issues. They may also frequently experience paranoia, possibly feeling continually suspicious of other people and their motives, with or without a cause. They may be fearful that people around them are trying to hurt them, either physically or emotionally. Causes of paranoid personality disorder. At this time, there is no scientifically proven singular or exact cause of paranoid personality disorder. However, researchers have many theories as to how and why this condition develops. There may be a genetic link between schizophrenia and PPD, but many believe there isn't enough information available to conclusively confirm this link. However, other theorists generally suggest that there are environmental factors contributing to the development of PPD, such as having a parent with a psychotic disorder, a physically or emotionally traumatic childhood, such as being a survivor of abuse or witnessing acts of violence as a child, may also play a role in why someone develops PPD. Regardless of the cause, individuals with paranoid personality disorder may exhibit many similar symptoms. Symptoms of paranoid personality disorder. Symptoms of paranoid personality disorder might first appear in early adulthood. Some of these symptoms can include excessive anger or grudge holding against people believed to have mistreated them, and refusing to accept apologies or attempts to make things right. A tendency to misinterpret neutral or even friendly interactions from others as negative or hostile. Continual suspicion of their spouse, such as believing they're cheating even when there's no proof. Displaying extreme sensitivity when they experience any kind of rebuff, criticism, or rejection. A belief in and preoccupation with conspiracy theories about the world and their life. Hostility towards others without justification. Difficulty working with others, such as working in a team setting at work or in school. Social detachment. Or symptoms of an anxiety disorder. It's important to note, however, that exhibiting these symptoms does not automatically mean you'll be diagnosed with paranoid personality disorder. Let's take a closer look at the diagnostic process for PPD. Diagnosing paranoid personality disorder. As I mentioned earlier, generally, mental health conditions can only be diagnosed by working directly with a licensed professional. If you suspect you might have paranoid personality disorder, the diagnostic process typically begins with a physical examination to make sure there are no health issues to account for any symptoms you may be experiencing. The exam may include blood and screening tests. Additionally, the doctor may ask many questions about your health to get a full picture. Once the physical checkup is complete, the doctor may sit down with you to evaluate your psychological well-being. This can include in-depth discussions about your emotions, thoughts, and behaviors. Once the doctor has a full picture of your physical and psychological symptoms, they may compare them against the criteria set out in the DSM-5 and provide a diagnosis. They might also do this with the help of other allied professionals, such as a psychiatrist. Typically, once the diagnosis is in place, you may begin treatment. Treating paranoid personality disorder. While paranoid personality disorder may be successfully treated, it can also be a challenging disorder to treat. This can be due to many reasons. For example, when an individual goes to see a doctor or health professional for treatment, trust can play a large role. Since those who live with PPD might feel naturally distrustful and suspicious, and they may not believe their behavior is unusual or unwarranted, doctors might have a harder time connecting with the patient to build trust and form a treatment plan. It can take considerable time and effort for a mental health professional to gain the trust of an individual with PPD. Once trust has been achieved, the best treatment method for PPD is generally psychotherapy. By using various talk therapy methods, such as individual and group therapy, the individual can be empowered with coping skills and taught how to handle their symptoms effectively. They may also receive training on how to conduct themselves in social situations and can learn to decrease their feelings of mistrust and paranoia over time. In some cases, it may be more comfortable for people with PPD to connect and build trust with a therapist online rather than in person, as they can do so from the comfort of their homes, helping them to possibly feel that they have more control over the interaction. Platforms like BetterHelp can assist in connecting individuals seeking online therapy with licensed professionals who can help. Have you noticed any of these symptoms in yourself or a loved one? For more insights on paranoid personality disorder and how to manage it, along with other mental health conditions, subscribe to our channel and turn on notifications so you don't miss any new tips. Paranoid personality disorder can be a complex condition to diagnose and treat, but with the help of a professional, it can be possible. Thanks for joining us today to learn about PPD. I hope you found this information helpful. Until next time, take care. Don't forget to subscribe for more helpful tips that can help you improve your mental health and well-being.